How do disability rights impact LGBTQ plus healthcare advocacy? Imagine a world where everyone can get the healthcare they need without facing extra hurdles. That's what disability rights aim for, and it plays a big role in supporting LGBTQ plus healthcare advocacy. When we talk about people who are LGBTQ plus and have disabilities, their challenges often overlap, making access to care even more complicated. Disability rights push for healthcare that is accessible and fair for all, regardless of physical, sensory, or mental health needs. This means clinics and hospitals should have ramps, sign language interpreters, and staff trained to understand different needs. Many LGBTQ plus individuals with disabilities depend on government programs like Medicaid for their health care. Disability rights advocates have fought to make sure these programs cover important services, including gender-affirming care for transgender and non-binary people. For example, courts have ruled that gender-affirming treatments are part of necessary health care covered by disability benefits. But restrictions still exist, and disabled transgender people often face barriers to getting this care. Disability rights groups work to remove those barriers and ensure everyone can access the care they need. Legal protections also matter when it comes to guardianship. Sometimes, guardianship laws have been used to separate LGBTQ plus partners or deny them medical decision-making rights. Disability rights advocates push for laws that respect relationships and personal autonomy, so LGBTQ plus people with disabilities can make their own healthcare choices. This helps prevent abuse and ensures their rights are protected. Another key area is making sure healthcare providers understand both disability and LGBTQ plus issues. Sometimes, disability services overlook sexual and gender identities, while LGBTQ plus healthcare providers may not be trained on disability needs. This gap can make it hard for people to get the right support. Advocates promote training programs for healthcare workers to be sensitive and knowledgeable about both areas, so patients feel respected and understood. Practical steps include expanding Medicaid to cover all necessary gender-affirming treatments without restrictions, training healthcare staff on LGBTQ plus and disability issues, reforming guardianship laws to protect personal relationships, and creating resources for LGBTQ plus youth with disabilities who often feel isolated. Policies should also explicitly ban discrimination based on both disability and LGBTQ plus status in healthcare settings. In short, disability rights shape LGBTQ plus healthcare advocacy by emphasizing that healthcare must be accessible, respectful, and inclusive. When these rights are upheld, it helps remove barriers and creates a fairer system where everyone can get the care they deserve. This intersectional approach is vital for making healthcare truly equitable for all members of these communities.